Hey, altruistic friends and followers, besides well known critics to whom I am thankful for letting me know my negatives. At the outset, I wish you and your beloved a safe journey in 2021 too, in spite of the two waves of corona, the third wave very much imminent, real soon, all with high mortality rates besides other natural calamities all over the globe, including India, of course. It is social activist come good-hearted preacher Professor S. Suresh back with altruistic delight for my 153rd video on anvil of publication on YouTube today, 4th August 2021, Wednesday. The topic for today is animal assisted therapy or intervention and its positive effects on mental health. Animal assisted therapy AAT shortly is an alternative or complementary type of therapy that includes the use of animals in a treatment. Not only animals, different species. It falls under the realm of animal assisted intervention, which encompasses any intervention that includes an animal or other species in a therapeutic context, such as emotional support animals, service animals trained to assist with daily activities, and animal assisted activity. AAT can be classified by the type of animal, the targeted population, and how the animal is incorporated into the therapeutic plan. The most commonly used types of AAT are canine assisted therapy, equine assisted therapy. The goal of AAT is to improve a patient's social, emotional, or cognitive functioning, and literature reviews state that animals can be used for educational and motivational effectiveness for participants. Studies have documented the positive effects of the therapy as reported on subjective self-rating scales and on objective psychological physiological measures such as blood pressure and hormone levels. Edward O. Wilson's biophilia hypothesis in 1984 is based on the premise that our attachment to and interest in animals stems from the strong possibility that human survival was partly dependent on signals from animals in the environment indicating safety or threat. The biophilia hypothesis suggests that if we see animals at rest or in a peaceful state, this may signal to us safety, security, and feelings of well-being, which in turn may trigger a state where personal change and healing are possible. 6 neurotransmitters that influence the mood have been documented to release after 15 minutes or more interaction with animals. Mirror neuron activity and disease perception through olfactory, smelling ability in dogs may also play important roles in helping dogs connect with humans during therapeutic encounters. Animals can be used in settings such as prisons, nursing homes, mental institutions, and in the home too. The techniques used depend on the need and condition of the patient. Assistance dogs can support certain life activities and help people navigate outside the home. Assessing whether a program is effective as far as its outcomes are concerned is easier when the goals are clear and are able to be specified. There are a range of goals for AAT programs relevant to children and young people, including enhanced capacity to form positive relationships with others. It is understood that pets provide benefits to those with mental health conditions, but further research is required to test the nature and extent of this relationship with an animal as a pet and how it differs between pets. Emotional support animals, service animals, and AAT. Acquired brain injury survivors with cognitive impairments can benefit from AAT as part of a comprehensive rehabilitation treatment plan. Therapists rely on techniques such as monitoring a child's behavior with the animal, their tone of voice, and indirect interviewing. AAT can be used in children with mental health problems as a standalone treatment or along with the conventional methods. Animals can be used as a distraction method when it comes to various situations or pain, and animals can also help bring happiness, pleasure, and entertainment to the pediatric population. Pediatric children, basically. Animals can also improve children's moods and reinforce positive behaviors while helping to increase negative ones. Most commonly reported research results are decreased anxiety and pain within the pediatric population. Dogs have shown to increase comfort and decrease pain in pediatric palliative care. Specific tactics have not been researched, but collective reviews of varied techniques displayed similar results of increased comfort reports by children and guardians. Animal assistance programs may be useful in prisons to relieve stress of the inmates and workers or to provide other benefits, but further study is needed to confirm the effectiveness of such programs in these settings. Internal file data reviews, anecdotal stories, and surveys of inmate and staff perceptions have been used to gauge the effectiveness of AAT in prisons, but these methods are limited and have resulted in an inadequate assessment. Researchers have, however, begun to find methods of gauging the effectiveness of prison animal programs (PAP) by using propensity score watching. Conclusions through this method showed that PAPs positively impact reductions in severe or violent infractions. The reduction in offences statistically may reduce the recidivism and rates and increase former inmate job marketability and societal reintegration. Training and being responsible for an animal can foster empathy, emotional intelligence, communication, and self-control in inmates. However, the results of studies done so far must be taken with caution as the methodological quality of existing studies is limited. PAPs also benefit the animals involved, as many come from situations where they face abuse, neglect, or euthanasia. The findings offer proof of the concept that canine-assisted therapies are feasible and can elicit positive quality of life experiences in institutionalized people with dementia. The researchers and practitioners need to elucidate the theoretical foundations of AAT. The lived environmental life quality model may serve as a guide for client-centered, occupation-focused, and ecologically valid approaches to animal-assisted occupational therapy beyond people with dementia. When elderly people are transferred to nursing homes or long-term care facilities, they often become passive, agitated, withdrawn, depressed, and inactive because of the lack of regular visitors or the loss of loved ones. Supporters for AAT say that animals can be helpful in motivating the patients to be active mentally and physically, keeping their mind sharp and bodies healthy. A significant difference has been seen among verbal interactions among nursing home residents with a dog present. Therapists or visitors who bring animals into the sessions at the nursing home are often viewed as less threatening, which increases the relationship between the therapist, visitor, and patient. Various animal species are used in AAT. Individual animals are evaluated with strict criteria before being used. The criteria include appropriate size, age, aptitude, typical behaviors, and the correct level of training. The most commonly species are dogs and horses. Equine. Research has been published on dolphin theory too. In canine-assisted therapy dogs interact with clients in animal-assisted interventions to enhance therapeutic activities and well-being, including the physical, cognitive, behavioral, and socio-emotional functioning of clients. Well-trained therapy dogs exhibit the behavior that human clients construe as friendly and welcoming. They comfort clients via body contact. Therapy dogs are also required to possess a calm temperament for accommodating the contact with unfamiliar clients while they serve as a source of comfort. They promote patients engaging in interactions which can help a patient improve motor skills and establish trusting relationship with others. The interaction between patients and therapy dogs also aids reducing stressful and anxious feelings patients have. Due to those benefits, canine-assisted therapy is used as a complement to other therapies to treat diagnoses such as post-traumatic stress disorder, attention deficit hyperactivity disorder, autism spectrum disorder, and dementia. Canine assistants can also be used in classroom for promoting the development of creative writing and living skills and the participation of children in group activities. There are programs called canine assisted reading programs which facilitate children with special educational needs. These programs utilize the calm, non-judgmental, happy characteristics of canines to let the process of reading become more meaningful and enjoyable for children. With these benefits, researchers suggest incorporating dogs into assisting learning and educational programs. Dolphin assisted therapy refers to the controversial alternative medicine practice of swimming with a dolphin. This form of therapy has been strongly criticized as having no long term benefit and being used on flawed observations. Psychologists have cautioned that dolphin assisted therapy is not known to be effective for any condition and that it presents considerable risks to both human patients and the captive dolphins. The child has a one on one session with a therapist in a marine park of some kind. An ethical issue with the data on dolphin assisted therapy and the effectiveness of it is that most of the research is done by people who operate the dolphin assisted therapy programs. A distinction exists between hippotherapy and therapeutic horseback riding. The American Hippotherapy Association defines hippotherapy as a physical, occupational, speech language therapy treatment strategy that utilizes equine movement as part of the integrated intervention program to achieve functional outcomes, while the Professional Association of Therapeutic Horsemanship International defines therapeutic riding as a riding lesson specially adapted for people with special needs. Adapted. According to Mary Becker, hippotherapy programs are active in 24 countries and the horse functions have expanded to therapeutic riding for people with physical, psychological, cognitive, social, and behavioral problems. Hippotherapy can also be has been also been approved by the American Speech and Hearing Association as a treatment method for individuals with speech disorders. In addition, equine assisted psychotherapy uses horses for work with persons who have mental health issues. Equine assisted psychotherapy (EAT) shortly often does not involve riding. Pigs have also been used in various types of AAT to perform duties in facilities including airports, hospitals, nursing homes, and special needs schools, or as emotional support animals for individuals with conditions such as autism or anxiety and veterans with post-traumatic stress disorder, shortly PTSD. Two well-known miniature pigs named Thunder and Bull, trained by children to certified animal therapy status, have been put to work in a number of nursing homes, schools, and hospitals. Based on current research, uh, there are many conditions that can benefit from AAT in diverse settings around the world. Those conditions include psychological disorder, developmental disorder, dementia, cancer, chronic pain, advanced heart failure, etc. AAT is commonly used for psychological disorder, attention deficit hyperactivity disorder, autism spectrum disorder, post-traumatic stress disorder, and major depressive disorder are among the psychological disorders that can benefit from AAT. Children with attention deficit hyperactivity disorder may decrease behavioral issues and improve socialization skills with the intervention of AAT. Compared to children who received cognitive behavioral therapy (CBT), children who received both canine assisted therapy and CBT had reduced the severity of attention deficit hyperactivity disorder symptoms. However, the dog assisted therapy did not relieve symptoms in long-term treatment. Post-traumatic stress disorder is a psychological disorder that affects people's mental health and has varying severity and forms. It is often difficult to treat due to high dropout rates and low responses to traditional therapeutic approaches and interventions. Animals have both direct and indirect effects on the mental health spectrum, including biological, psychological, and social responses, further targeting mark systems of post-traumatic stress disorder, that is, re-experiencing avoidance, changes in beliefs, feelings, and hyperarousal. Direct effects of animals include a decrease in anxiety and blood pressure, while indirect effects result in increased social interactions and overall participation in everyday activities. Biologically specific neurochemicals are released when observing human and animal interaction. Similarly, dog assistance can potentially mediate oxytocin, and which affects social and physical well-being and decrease the blood pressure. The psychological benefits of animals focus mainly on dog and human interactions. The reduction of anxiety and depressive symptoms and increased resilience. Animals in this capacity can further provide emotional and psychological assistance and support addressing several of the disorder symptoms. The presence of an animal can alleviate intrusion symptoms by providing a reminder that there is no danger present. Animals can further elicit positive emotions, targeting emotional numbing experiences. Animal interactions also provide social benefits, providing companionship and alleviate feelings of loneliness and isolation through everyday routines and increased social interactions in public. The incorporation and involvement of animals dates back to the earliest forms of organized combat. Dogs, in particular, were utilized in different capacities. Ancient armies employed dogs as soldiers and companions, which extended to modern combat, including dogs as a crucial asset in communication, detection, and intimidation. In World War II, dogs were used in therapy as emotional support during World War. While a range of animals can be utilized, dogs and horses have been in the principal species studied in practice. Dog-assisted therapy and therapeutic horseback riding are non-invasive methods for treating post-traumatic stress disorder in veterans. Canines can easily integrate into a multitude of environments, are highly responsive to humans, and are very intelligent. For these reasons, dogs are the species most commonly used in interventions. Dogs are typically categorized according to the level of training received and the specific needs of the individuals. A service dog provides relief through specialized support related to physical, mental, or psychological disability. Emotional support animals solely provide psychological relief and do not require specialized training. Therapy animals often provide additional support in a therapeutic environment by supporting counselors or therapists in their therapeutic duties. While service dogs, emotional support animals, and therapy dogs can support the diverse symptoms that veterans, specifically bred and selected post-traumatic stress disorder service dogs, are trained and assigned to veterans with a disorder to support with the daily life activities as well as with emotional and mental health needs. Dogs provide subjective positive effect to veterans and serves as a compassionate reminder to veterans suffering from post-traumatic stress disorder that danger is not present, creating a safe space for the veterans. They are often sensitive to humans and have the ability to adapt their behavior accordingly by using tasks such as preventing panic, waking a veteran from a nightmare, and nudging to help the veteran stay in the present. Dogs provide veterans with a non-judgmental and safe environment that can help a veteran express feelings and process thoughts without interruption, criticism, or advice. Interactions such as petting, playing, and walking with a dog can increase physical activity, reduce anxiety, and provide encouragement to stay in the present moment. The interaction between dog and veteran supports social interactions for isolated veterans, reduces symptoms associated with the disorder such as depression and anxiety, and increases veterans' calmness. Similar to dogs, horses have been included in the treatment of veterans suffering from post-traumatic stress disorder by providing an accepting and a non-judgmental environment, which further facilitates a veteran's ability to cope with the symptoms. Because horses are social animals, they are capable of creating and responding to relationships based on the veteran's energy, providing an opportunity for veterans to regain the ability to form trusting relationships. Therapeutic work with the horses varies from ground-based activities, mounted activities, or a combination of both. The therapeutic context, horses can promote cognitive reframing as well as an increase in the use of mindfulness practice. While there is limited research and standardized instruments to measure the effects, veterans who are participating in pilot programs have better communication skills, self-awareness, and self-esteem, promoting safety and support during the transition into civilian life. Long-term effects of canine-based Equine-based interventions with veterans include increased happiness, social support, and better sleep hygiene because they are able to process information regarding their emotions and behaviors in a non-judgmental space. While animal-assisted interventions can be effective, there are limitations due to limited research. Furthermore, studies approved yield small sample sizes which limit the power to detect changes as well as the specific tasks that are particularly helpful to veterans. AAT may also abstract veterans from cultivating their own way of control over stressful situation. Post-traumatic stress disorder, shortly PTSD, can develop when a person experiences a sexual assault or rape. Sexual assault, that is one of the things. Sexual assault is a leading cause of PTSD in women. An estimated 50% of women who are sexually assaulted do develop the condition. AAT in can be effective in treating the trauma for survivors of sexual assault. The presence of dogs has been shown to improve communication between the survivor and the therapist and to decrease survivors' anxiety and fear responses. AAT increases social interaction for those with the disorder. Studies show that AAT leads to an overall reduction of symptoms including anger, depression, and dissociation in survivors of sexual assault. AAT has also been shown to reduce problem behavior and improves overall behavioral functioning for children survivors of sexual assault. While results are promising, further research is needed to show the effectiveness of animal assisted interventions in treating PTSD for sexual assault. Survivors across varying demographics. AAT may reduce the symptoms of autism spectrum disorder such as aggressiveness, irritability, distractibility, and hyperactivity. In one review, 5 out of 9 studies reviewed showed positive effects of positive effects of therapeutic horseback riding on children with autism spectrum disorder. Canine assisted intervention provides a calmer environment by reducing the stress, irritation, and anxiety those children with autism spectrum disorder experience. Playing with the dogs increases the positive mood in children with autism spectrum disorder. Animals also serve as a social catalyst. In the presence of animals, children with autism spectrum disorder are more likely to engage in social interactions with the humans. AAT encourages expressions of emotions and cognitive stimulation through discussions and reminiscing of memories while the patient bonds with the animal. Studies have found that AAT, particularly using dogs, resulted in measurable quality of life improvements for patients with dementia. Patients with dementia were also found to improve their social interactions and the scores on the Cohen-Mansfield Agitation Inventory. AAT has been shown to slightly reduce depressive symptoms in people with dementia as per studies conducted in 2019. Occupational therapists (OT) can use AAT to work on the child's motivation. Some OT goals using AAT in improving attention skills, social skills, and participation in play, self-esteem, and reducing anxiety, loneliness, and isolation. Specially trained canine dogs are used to guide blind people. Any kind of animal, whether it be a dog, cat, horse, or birds like parakeet, lovebirds, or even marine species like fish, are good companions for people living in isolation, especially elders, since it's mostly nuclear families. Dogs are very loyal to their owners and provide physical security better than security guards, electronic surveillance systems like CCTV, burglar alarm, etc. So far, we reviewed the positive aspects of this type of therapy. You know, a coin has two sides. So now let us review the limitations. There is limited scientific research on the use of the therapy among adults who have been sexually assaulted. While animals do tend to comfort victims, animal therapy may not be the catalyst that provides positive success in therapy sessions. Adults tend not to focus as much on having an animal companion, and therefore animal therapy cannot be attributed as a reason for success in those types of therapy sessions. There are some ethical concerns that arise when applying animal therapy to younger victims of sexual assault. For example, if a child is introduced to an animal that is not that pet, the application of animal therapy can cause some concerns. First of all, some children may not be comfortable with animals or may be frightened, which could be avoided by asking permission to use animals in therapy. Second, a special bond is created between animal and child during this animal therapy. How, therefore, if the animal in question does not belong to the child, there may be some negative side effects when the child discontinues the therapy. The child will have become attached to the animal, which does raise some ethical issues as far as subjecting a child to the disappointment and possible relapse that can occur after the therapy discontinues. It is unclear to what degree the animal itself contributes to the recovery process. There are some concerns specific to dolphin-assisted therapy. First, it is potentially hazardous to the human patients, and it is harmful to the dolphins themselves. By taking dolphins out of the natural environment and putting them in captivity for therapy, can be hazardous to their well-being. Second, dolphin-assisted therapy has been strongly criticized as having no long-term benefit and being based on flawed observations, as I said before. Third, psychologists have cautioned that dolphin-assisted therapy is not effective for any known condition. There are concerns that people may become dependent on the animal and could interfere with the recovery process for PTSD. People may feel as though they cannot do things on their own without the presence of the animal. In other words, it causes a kind of addiction, and certainly withdrawal symptoms will arise, which may lead to a relapse of the same problem again. Despite the benefits noted for humans, recent research shows that animal-assisted interventions can have a negative effect on the mental and physical well-being of the animals due to the unclear structural guidelines on the use of animals in therapeutic settings and leaving possibilities of the animals being harmed and exposed to stressful situations. Research has shown that despite quality guidelines in place to ensure the health of the therapy animal, there are reports of negative interactions between human participants and therapy dogs. These reports include mistreating and teasing the dogs by patients and staff at locations in which therapy is hosted. In studies conducted, certain disabilities had to be excluded from the experiment due to an increase in the stress of the therapy dog and ultimately decline in overall well-being. Equine assisted therapy showed a need for more studies on equine behavior to obtain an understanding of stress signals from horses. They also undergo stress, everything, anxiety, fear, water, like humans. Through understanding the stress signals shown by horses, they also become nervous. Even dogs. Shown by horses, a safe and healthy experience during the therapy session can be held by allowing handlers to minimize stress. For therapy animals, limited time for rest, multiple sessions, and long duration of sessions were linked to higher stress. Assessing animals for signs of fatigue and stress. ECG, EKG can prevent negative experience for both humans and animals involved. Animals used should be limited to specific durations and the number of sessions, as well as given access to proper environmental conditions, food, water, and rest. In olden days, children used to play games outdoors, which were a good physical exercise for the whole body and mind, besides real social interactions with others in the age group. Now we are living in a digital world, useless. Playing video games, indulge in social networking, and ultimately turn as gadget freaks and mouse couch potatoes. This results in social isolation, and such will result to substance abuse also because of the social isolation. This has happened in so-called online education too, and only now people have realized that online education is not effective and started cribbing. Watch my video on online education published on YouTube a few months back if you are interested in getting to know the pitfalls. An alternative to people that can afford it is, instead of real pets, go for virtual pets or robot dogs readily available in the market. I know pretty well robo or virtual pet is not a compatible substitute for a real pet. Another alternate is going back to joint family system like olden times. This is a better alternate than the former one. Socialize as much as possible in real life, but exercise caution since people are not trustworthy, attributed to the materialistic life. Never lead a sedentary life, eat organic foods, live in harmony with nature, keep yourself engaged till death. Idle mind is devil's workshop. Always remember that. Practice mindful meditation, curb damage to the environment and ecology in all ways possible. Stay away from psychopaths. Avoid all kinds of synthetics. Be content with what you have. Look down and not up. This list is not exhaustive. About 5 decades back, people used to consult medical doctors once a blue moon. And psychologists, psychiatrists were terms not heard of by majority of people in this world. Medicine was considered a noble profession, but no more, since there is so much exploitation in this arena. Now, counselors and assisted reproduction centers are there in every nook and corner. Demand has skyrocketed. Is it not a heavy price we are paying because of nuclear families living together out of wedlock, love marriages, and mechanized life running around all the time after money? Think through. Think through, guys. Okay, debates, discussion on open-ended topics like this can go on forever. Anyhow, let me pull the plug here. We'll meet again real soon with another interesting topic. Some of the statements, views expressed are solely mine, based on limited knowledge gained over 6 decades of versatile experience. Always watch these videos with a closed caption, subtitles for absolute 100% comprehension as per my sincere recommendation. Zillion times so far, I know I rushed to complete the presentation within 20 minutes maximum. This time limit is self-imposed to retain the viewer's attention as a norm. I am quite aware of the fact that I exceed this time limit. Sometimes I take double or even triple this time depending on the topic, since I make honest attempts to cover the selected topic more elaborately, including so many intricate fine details, referring a wide variety of sources, in particular Wikipedia quite extensively, besides articles and books published recently. Besides, of course, I sprinkle my own salt and pepper and season it with my personal experiences so far in my life and also intuition. Stay at home as much as possible to maintain social distancing attributed to the pandemic novel COVID-19 and prolong your lifespan. Lead a healthy life. God, also known as the Supreme Power, is the one and only one who can disrupt natural and unconventional events like biowar and cyber war, like pandemics and epidemics, which ultimately paves the way for for apocalypse and extinction of all sentient species on Earth for no fault of others. Rest in peace and harmony. Today I've taken only 33 minutes. Not bad.